We're pleased to introduce transcranial magnetic stimulation as a treatment for treatment-resistant major depression. TMS is a type of treatment that uses an electromagnetic coil to introduce an electrical change in the brain that helps patients to improve the state of their depression over a treatment course period of 4 to 6 weeks, daily treatment.
Works by, talk about the neurotransmitters.
Sure. The magnetic field of the coil closes a circuit inside the brain that allows electrical energy to flow to a center of the brain that's responsible for depression and regulating mood. Through the course of this treatment, the device TMS effectively wakes up a center of the brain and allows it to be jump-started. That helps the body reconnect with producing the neurotransmitters and the other electrical energy that allows for the regulation of mood in patients that are previously not regulated.
What happens is we often say that there's a chemical imbalance that causes depression, and that's not really accurate, but that's probably close enough to make sense to people. The coil itself sits right on the head, and the magnetic field penetrates a little bit below the skull to an area that's called the prefrontal gyrus, and makes a change there, and there's a feedback loop between that and deeper down in the brain, the area that actually affects mood. So by treating in a small amount of magnet in a fairly superficial way, we actually get a deep change that goes all the way down to the brain, stimulates that part, and makes it start putting out the chemicals in the normal amounts. So our handy volunteer here has agreed to sit in the chair. After a person reclines, we do a lot of different measurements to make sure things are lined up correctly. And I'm just showing one of them. We measure where the current of the magnetic coil is actually going to go. We do a couple different things there using these different sliders, and then once we have that set up, which I'm not going to go through how we actually do it, we place the coil on somebody's head. This is the coil, and it's going to make a little clicky noise because it has an air brake. We would put all of those parameters in here for how high, low, forward, back, and how much magnetic current was necessary, and then we would start treatment, and it would make a noise that I can't replicate here, but it goes tap 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 tap. Sounds a little bit like a woodpecker, and it delivers a burst for 4 seconds, and then there's a 26-second pause, and that cycle repeats every 30 seconds for 37.5 minutes. And then treatment's done, and the person can get up and drive himself home. Sure. Actually, what we do is, in order to find the area of the brain, because everybody's head is shaped differently, is bigger or smaller, whatever, we find what's called the motor area of the brain. The brain is actually mapped in the motor area. You get hand, you get thumb, you get face, so you want to get it right to thumb. Once we have that setting, we actually measure 5.5 centimeters forward from that, and that's where we want to be.
Gotcha. So what Dr. Doherty was referring to is before we decided to advocate for bringing this device to our region to help the population health of our citizens was we both have, and others in our office have, felt what this device feels like, this treatment feels like. Not a full course of treatment, but we wanted to feel and be able, what it felt like, and be able to tell people it does not hurt, and it's an awake procedure, and be able to really explain a little bit more about what the process is. So lots of research went in and was done prior to that trial, but it is something that I felt, and many of the staff here and physicians here felt as well.